there, and we are here today to actually discuss a topic which is bittersweet, and that's kids with kidney problems. But it's going to be happier today because we have with us a fabulous doctor who's going to make sure that we understand what everything is. But today I'm going to start with a quote by Oscar Wilde that says, the best way to make children good is to make them happy. And that's what Kidney Warriors Foundation is actually here to do, to make sure that we make our children who are affected by this horrible disease happier, because they will be able to cope with this particular disease. CKD unfortunately spares no one, no matter what your caste, creed, religion, or age is. But KWF is here to make sure that we will make it an easier journey, and sometimes, honestly, a happier one. Because this is a community of people that get together to understand each other, hold each other's hands, and we move on to finding solutions for all the problems that are vertically put in front of us. Today we have with us a very, very dynamic, young and qualified doctor, Dr. Nivedita Kamath. She's the Associate Professor, the Department of Pediatric Nephrology in St. John's Medical College, Bangalore. Her areas of special interest would include CKD, chronic kidney disease, chronic dialysis, and neonatal AKI. The positions that she has held till now are the honorary faculty at the Kasturba Medical College in Bangalore, member of the Bulletin Editorial Board, Indian Society of Pediatric Nephrology, and member of the Committee for Priorities in Low-Income Countries, International Pediatric Nephrology Association. So we're very, very happy to have you here. And actually, our heart is at ease today because we know that somewhere in our lives, we have someone who's going to take fabulous care of our children. Over to you, Dr. Kamath.
Thank you so much for those kind words of introduction. I'm so honored and privileged to be associated with a group of committed individuals who are spending so much time, effort, and their energy to make lives easy for children and adults with kidney disease. This is the need of the hour because there are so many, in fact, India is very high on the list, maybe not the number one, but soon to be the number one in kidney failure. And that's such an unfortunate event. So we need people like this to help all the doctors and the nurses and the medical teams to make lives better for patients. And I'm so happy to be associated with you. I'm so proud of all the work that you've been doing, and thank you for this opportunity. So let me quickly go to my presentation. I've put in a few points. This is not just about CKD in children, but I'll be happy to take questions about CKD if that is what worries most of the parents who are attending this session. But we will talk about kidney disease in children in general, because most often until parents face a child or have to deal with a child who has a kidney problem, they are not even aware that kidney problem happens in children. So very often we are asked this question, oh, do children also have kidney problems? They certainly do. Unfortunately, they do. And there are several things that we can do about it. There are some things, of course, that we can't completely cure, but we can definitely help them make their lives easy and let them lead as normal a life as possible. So very briefly, I'm going to talk about this because I want the parents to ask their questions and have enough time to answer that, hopefully. And let me just start by saying today, let's discuss about what are the common problems in children with kidney disease, and how do we actually identify, or how do you know that your child has kidney problem, and what are the general measures that you have to take? I'm not going to deal with specific problems, but in the question and answer session, definitely I'll be happy to take questions on that. So hi everyone, especially if there are little kids here. I'm a kidney doctor for little kids, and I'm happy to help you understand about kidney problems in children and what you can do about it. This is my email ID, and feel free to reach out if you have any questions. Even after the session is over, if you want to ask me any questions, please feel free to do so. The most important thing that we try and stress among doctors, among pediatricians, among our undergraduate students, among family physicians, is that early detection is important, because a lot of kidney problems in children can be detected early. A lot of them, if they are detected early and treated quickly, can be prevented from progressing, and we can do something to help these children at least grow up to become reasonably healthy adults. So how do we recognize these common kidney problems in children? What are those red flags? Kidney disease can be detected as early as in the pregnancy itself. However, not all kidney problems can be picked up in a pregnancy scan. But if your pregnancy scan shows that there is some kidney problem, make sure that you get it tested once the baby is born. If there is a significant kidney problem, please do visit a neonatologist or a pediatrician and seek help. You may be referred to a pediatric nephrologist or a nephrologist who will be able to give you some idea about what the kidney problem is likely to be and what should be done after the baby is born. Very, very, very often we see this sad story where something has been picked up in the in the scan during the pregnancy, but has not been followed up after the baby is born, because the baby passes urine, everybody is happy that they have a baby, and the baby is otherwise healthy, feeding well, so they think that everything is fine, and only later do we find these children having kidney problems. So please, if you have anything in the kidney scan of your baby during pregnancy, please get to know more about it and what to do after the baby is born. Secondly, poor growth. Now, poor growth, as a pediatrician, one would say there are 1,500 causes of poor growth in children. But one thing to remember is that kidney disease is one of them. Why is kidney disease not detected early? Why are people not aware about kidney disease in children? The problem is that it does not have specific signs and symptoms. Some heart disease may have something, liver disease, presents as jaundice. So there are different conditions which present with specific symptoms. Unfortunately, kidney disease doesn't have a specific clinical symptoms of its own. So it manifests in very, very different ways. So we need to have a high index of suspicion. We need to suspect that something is wrong. If a child is not growing well, if a child is not growing as much as children of his or her age, definitely that there's something wrong going on. Of course, malnutrition or the absence of good nutrition is the most common cause in our country, but we need to look at other things as well, and that kidney disease should be one of the things to consider. Now, anemia again, or low hemoglobin or less blood, is again a very, very common problem in our country. The most common cause for this is nutritional, that we lack the required vitamins like iron and B12 and folate in our food, but also kidney disease can just present as low blood or less hemoglobin that may require blood transfusion. So if your baby is or your child is having low hemoglobin that is requiring multiple sessions of treatment, one of the causes could be kidney disease. So keep this in mind. The next thing is bent bones. Often we see that children are referred to us from the orthopedic surgeon because they think that this is a problem of the bones and they want some surgery to be done to correct the bones. But when they come to us and we do the blood test, we find that this child has got kidney disease. So if there is a child with bent bones, one of the possibilities is also kidney disease. So keep that in mind as well and do not neglect it. Swelling, of course, this is probably one of the more commonly known problems, that a child with kidney disease can have swelling. Of course, other conditions can also have swelling, but if there is swelling, predominantly on the face, but also maybe over the entire body, do consult your doctor immediately. High blood pressure. This again is very classically thought to be a problem of adults. Unfortunately, children with kidney disease have high blood pressure. The guidelines now recommend that every child above the age of 3 years must have a routine, at least one annual blood pressure check. And we often find that children come to us with very high blood pressures, which has been undiagnosed for years because of some kidney disease. So when you go for your annual checkup, just make sure if your child is older than 3 years that you have at least one blood pressure checked in a year. Of course, this is one of the very scary symptoms that parents immediately rush to the hospital. Not all children with red urine have got severe kidney disease, but sometimes it could be a severe kidney disease. Nevertheless, any child presenting with red urine or blood in the urine needs to be thoroughly evaluated. So if your child has red urine, sometimes it could be a simple medication induced, it could be following an infection, or sometimes it could be a dangerous kidney disease itself. Whatever it is, make sure that you seek help early. If your child passes very little urine or lots and lots of urine, now the problem here is that we know babies pass a lot of urine. So how much is too much is very difficult to judge. But if you feel that the baby is, you're changing too many diapers, your older child is passing urine 2-3 times at night, is not gaining weight, is not growing well, is preferring to drink water instead of eating food, these may be some of the subtle features. So if you have any doubt, do consult your pediatrician. Too less urine, often this is not a problem because parents do recognize that very little urine, something is really wrong and may seek help. But too much urine may be missed, especially in a young child. If your child has a urine infection, unfortunately, in our country, we see that whenever a child has fever, parents go to most often just to the pharmacy and get antibiotics without even trying and seeing what is the cause of fever. And we see several children who come to us with repeated episodes of urinary tract infection that has been missed, that has not been treated or evaluated and found to have an underlying kidney disease. So if your child has also, sadly or unfortunately, in young children, the signs and symptoms of urinary tract infection, unlike those of that in adults, are not very specific. They may not be crying while passing urine. They may not be complaining of pain. It may just be fever. So whenever there is fever, make sure, if at least for more than 1 or 2 days, make sure you go and consult your pediatrician and don't take medications over the counter, especially antibiotics, without a consultation of your general practitioner or your pediatrician, whoever is the doctor you go to. So urinary tract infection, if missed, can lead to devastating consequences in children. The other important thing is the presence of a family history. So if there is a history of kidney disease in the family, now again, that is a very general statement. Not all kidney diseases run in families, but if there is a strong family history, say of stone disease, of polycystic kidney disease, definitely you need to get your child evaluated. So when you go to your pediatrician, do mention that there is a family history of kidney disease, and based on what the kidney disease is in the adults in the family, the pediatrician or the physician will be able to guide you as to whether you need to get this evaluated further or not. So do make it a point to alert your pediatrician about this. So these are the common red flags for kidney disease in children. And if you have any questions about this, I'll be very happy to answer that. Moving to the next part, that is, how do you take care of a child with kidney disease? Now, like I said, kidney disease is a whole spectrum. There are different kinds of kidney diseases. Some are inherited, that is, they're present right from birth and they manifest at different ages of life. Some are acquired, that is, a child gets it later in life, maybe due to infection, due to some other disease. And the treatment would be definitely very different for each of these conditions. So it's very difficult to give you a blanket method to take care of children with kidney disease, but there are some basic principles that we need to follow. There are some things that we need to keep in mind in any child with chronic disease, and definitely in children with kidney disease. One is, make sure that you try and identify the kidney disease early with all the red flags that we have discussed so far. Remember, many kidney diseases in children are treatable. Very often, this is the big fear in parents, that they come with a very simple infection or a very simple post-infectious glomerulonephritis, but they are worried to death. They think that, oh, my child is just going to go on dialysis next and the kidneys have failed. So this is not true at all. There are several kidney diseases which can lead to chronic kidney disease, even in children, but most of the kidney diseases that we see commonly in children are treatable. Many of them may be completely curable. Some of them we cannot cure, but we can control. And definitely our goal is to comfort you in every situation, whether we can cure or not. Regular follow-up is a must. Often we see, like I said, the symptoms and signs of kidney disease are not evident. So the parents feel that, okay, he's not growing much, but he's going to school, he's very smart, he plays, he's active, he's behaving like all children of his age. So it's unlikely that something is wrong. That is a very big myth, because kidney disease is often very, very silent. And only when it comes to the stage of, or the point of no return, when we come to the stage where we cannot go back and do something about it, that is when you start seeing all the problems. So just because you feel that the child is fine, do not stop your follow-up if you have been asked to do it. Follow the treatment advised. Now, many a time parents mix up, medications, they self-medicate. They feel, okay, especially nephrotic syndrome, okay, every time we go, the doctor just gives steroids. So why don't I just take it on my own? There's some swelling, there's some protein in the urine. Start him on steroids. Never ever do that. Because though it seems to you that the doctor is just giving the same medicine, each step of the prescription is well thought out. And the doctor is, after all, responsible for if anything goes wrong. But if you do it yourself, then who is going to be responsible if something goes wrong? So each medication that we give is done with a lot of thought and care. So please do follow the treatment advised. Ask your doctor. We always encourage our patients, if they are not happy, to seek second opinions, but do not self-medicate, especially over-the-counter medications, especially listening to what the neighbor or the person in your office has told you. Avoid medications that can harm the kidney. Simple medications like, for example, fever. If there is fever, you see all patients take ibuprofen, Meftal, irrespective of how high the fever is, whether there's really a need to do it. That's the first thing they go to, but it can harm the kidney, especially a kidney that is already having a problem, and you may not know about it. So definitely do not use these over-the-counter medications without consulting your doctor. This is, of course, general advice that is good for every child, but definitely needs to be maintained very cautiously in children with kidney disease. That is a balanced diet. We want our children to grow, we want them to be healthy, and we want them to do that with good nutrition that's available. So you would be familiar with this triangle. The Kidney Warriors Foundation has brought out a good book of recipes, and you can see more about that. But give them good nutrition. Cereals, whole grains, fruits, vegetables should compose most of their diet. Their diet should predominantly contain this. There should be moderate amounts of meat and dairy product and eggs and fish. That is the protein-rich food, and very little quantity or a very cautious quantity of fats and sugars. Water, of course, is important in healthy children. In children with kidney disease, it may depend on what your doctor tells you. Those who have a lot of urine output may need more water. Those who have less urine output may need to restrict water. So follow your doctor's advice on this. Definitely avoid junk food. That is a general rule for all children. It should be given very occasionally as a treat, not as a regular meal or not as a regular food that they go to. If you develop healthy eating habits at home, your children will also follow. Reduce salt as much as possible, and there is enough data to show in adults and in children that reducing salt is definitely beneficial. So as a family, try and slowly reduce salt. When your child has severe kidney disease, if you give him like totally bland food, he will definitely not be able to eat it. So slowly start reducing the amount of salt that you put. If you're putting 2 teaspoons, maybe try 1/3, 1.5, gradually over a period of few days, so that you can, as a family, restrict your salt intake. And believe me, that's going to be good for all of you. Exercise, of course, has tons of benefits, and there is lots and lots of data, especially in CKD in adults, to show that exercise improves their cardiovascular health, it improves their quality of life, it improves their sense of well-being. So definitely exercise whatever is possible within the house, outside the house, whatever is feasible for your child, try and encourage that and avoid sedentary habits. So all these measures to keep your kidneys healthy and happy, and to keep yourselves healthy and happy. Thank you. And let's go back to the question and answer session. Yes.
Thank you so much, Dr. Kamath. That was absolutely wonderful. And some of the take-homes from your presentation would obviously be, please remember never to self-medicate. Please do not rely on Google Doctor. Please always reach out to people who have somebody in their family that has got kidney disease, but still do not use the medication that they are giving you. Please, there is no scope for Ayurveda in this particular disease as a mainstream kind of treatment. Homeopathy, Ayurveda, we respect the concepts of it, but it may not work as a proper, line of treatment, because this particular disease has got so many comorbidities within it. We already have, Dr. Kamath, a question from the audience, and it's from Prasanna Kanaldekar, and is asking, how can we identify kidney disease in children, in infants?
So, like I said, kidney disease is very difficult to detect in children or adults. So some of the pointers that may be there, especially in infants, are, one is that the pregnancy scan may show something. Now, I want you to understand that this may not be true in all kidney diseases. Many kidney diseases can be picked up on a pregnancy scan. So if there is something that is reported abnormal in your pregnancy scan, then it needs to be followed up once the baby is born. Definitely, you need to take advice when you get the scan report itself. So you are mentally prepared as to what is to be done next, but it needs to be followed up after birth of the baby. So that is one good indicator to find that out. Rarely we see conditions like, nephrotic syndrome that can present in a baby with swelling, with not passing much urine. So these may be some of the markers. Just that the baby is not gaining weight. Well, the baby is feeding well, baby passes a lot of urine, but the baby is not gaining weight. This may be a sign that there could be an underlying kidney disease. Of course, there could be several other conditions also, but this could be one of the indicators that you need to go take your baby to the doctor and get him or her checked. Sometimes there may be some syndromes that are known that could be associated with kidney disease, or usually these are picked up early by the doctors and you are told about it. Sometimes babies who have malformations of one organ, like say a heart disease, there could be a coexisting kidney disease as well. They have a genitourinary malformation, they have an intestinal problem, they have a genital problem. These could be also associated with kidney disease. So when there are such pointers, definitely look for kidney disease. Like I said, passing a lot of urine could be one of the features, but it's usually missed because it's very difficult to find out how much a baby is passing, especially if you're using diapers. But if you feel that that is along with the baby not growing well, along with something else, some other symptom like a pregnancy scan that was abnormal or a family history, then do take your child for a kidney check.
All right, we have another question, and it's a very difficult question to answer, but of course, most parents want to know the answer to this, is why do children get kidney disease? And I'll take the second question also and put it together with this. You say your children has a kidney disease, but he looks absolutely fine. So how do you deal with these two situations? Where do they get it and why do they get it? But they look absolutely fine, but has it as well.
Right. No, that it's a very difficult question, like you said, and often we find it very difficult to explain to parents, because they want to know, why is it that my child has got, what is it that went wrong, and what have I done wrong that my child has this disease. So firstly, I want to say that, like all other diseases of all other organs, there are two major types of disease, just to put them very broadly into baskets. One is something that is inherited, okay, something that is a genetic condition. Now, it may come from the parents, it may come without parents having any disease. These two possibilities are there, but there could be genetic problems. Most of the conditions in children, especially the conditions that lead to kidney failure, are something to do with the development of the kidney while the baby is in the womb. Okay, so we call them as congenital abnormalities of the kidney and urinary tract, which means that while the kidney is like when your baby is, you just conceived about maybe 4 months, 5 months, I mean, it's not even months, weeks, when you are not even probably aware that you're pregnant, your baby's kidneys are developing inside. And at this time, there could be either a genetic problem or sometimes an acquired problem. Maybe the mother has had an infection, maybe the mother has taken some medications, maybe there is some insult in the form of malnutrition. There are several causes for this. And sometimes nobody knows exactly what the reason is that could affect your child's kidney development. So that is one major group of kidney diseases that you see in children, where the kidney has not developed properly. To explain it in simple terms, we often tell parents this is like a manufacturing defect. Now, you can imagine if a product is being made in a factory, 1 out of the million could be defective, right? And you never really know what the cause is. There could be 1,000 reasons for it, but that piece is defective and we cannot do anything to correct it. And that often becomes progressive and leads to kidney disease. Some of these defective things do not have chronic kidney disease. Some do. So we need to figure that out early and follow these children up. So that is one group of conditions which are inherited, which are due to the developmental abnormalities of the kidney. Some are acquired. It could be an infection that causes kidney disease, like the most common example that we give is a post-infectious glomerulonephritis, which means that following a sore throat or a skin infection, the reaction of your body to those bacteria could also harm your kidney. And your kidney may start, your child may start having symptoms like blood in the urine, swelling, high blood pressure. All these symptoms could happen. There could be infections of the urinary tract, which could cause like a urinary tract infection. So these are acquired causes. The other causes that are seen in older children and then in adults, like lupus, these are other diseases which affect many organs, but also affect the kidney. So actually, the kidney could be affected by a whole spectrum of diseases. Mostly in younger children, it is the inherited causes, but there could be other causes as well. Now, coming to the second part of the question, why do children with kidney disease have no signs and symptoms? Why do they look well? That is because now the kidney, is an amazing organ. It does so much work that until its work is really, really compromised, it doesn't let you feel the brunt of it. It's doing so much work on a daily basis. It's working 24/7 to purify your blood until the kidney function drops by more than 50%. Only then, or even less than that, is when we start seeing symptoms. So that is it's beneficial to us because it helps us survive. And it's not like when the kidney is slightly affected, it just says, okay, I'm going to stop working. It keeps working till it really, really can't. And that's why we don't get symptoms. But the flip side of that, or the disadvantage of that, is that often these signs and symptoms are missed. So having a high index of suspicion, being suspicious that, oh, there may be some problem, and evaluating early is the only solution we have. So, and also the kidney has a variety of functions. What most people think, and what is mostly, taught to us in primary schools and high schools, is that the kidney is a filtering organ. It removes toxic waste from the body. That is, of course, the major function of the kidney, but the kidney is also the organ that produces erythropoietin, which is required for your bone marrow to produce blood cells. red blood cells. So if the kidney is not working, that gets affected. The kidney maintains the bone health. The kidney is important for the heart to work. So, the kidney is actually a very big team player. It works in sync with all the organs of your body, and it helps maintain health. It, of course, maintains blood pressure. It maintains your what we call as homeostasis. That is, for the cells to function, they need to have a normal environment. Like, for us to function, we need to have a normal ambience or a normal environment at home. So the cells, our body cells, also need that, and the kidney does that. It produces, vitamin D, the active form of it, which is required for bone health. So the kidney has multiple roles. And so you may see that some children with kidney disease have low hemoglobin, some have bone problems, some have heart problems, some have blood pressure. So they don't present as one thing. Like usually if they have liver disease, they present as jaundice, which may not be true of the kidney. So I hope that answers the questions that have been put forth.
Thank you so much. That was such a lovely way of explaining it. And actually, the one thing is that we only think of the kidney as an organ that produces urine, actually, without realizing that it's responsible for the overall health of our entire body. And while you were talking about this, you also talked about, when you're pregnant, what you're going through could affect your child. Hence, the next question is, can kidney disease be detected in the pregnancy scan?
Yes, absolutely. Many kidney diseases can be. Not all kidney diseases can be detected on a scan because, like I said, some kidney diseases are inherited, that is, they are present right from birth. Some only manifest later, or they actually start developing later because of a medication, or because, let me say, for example, a snake bite could cause kidney failure. Okay, so that you obviously can't detect on because there was nothing wrong until then. So such conditions obviously cannot be, but there are some conditions which are there right from birth. These conditions can be detected during the pregnancy scan itself. Also, having said that, many kidney conditions that are detected in the pregnancy scan, not all of them are going to lead to kidney failure. Not all of them are, because this is one common question, and I'm sure some people may ask that, okay, if we detect something, should we then go for termination of pregnancy? So not all kidney diseases that are detected in a pregnancy scan are going to have devastating consequences or going to lead to kidney failure, but some of them could be. So identifying what it is, identifying what are the early markers of it, some, whether the kidney has not developed, whether there's an obstruction, whether the kidney is not, what is the likelihood of this progressing to kidney failure, all these need to be looked into. And some of these conditions can definitely be picked up on a pregnancy scan.
Thank you so much. I'm so sorry about the background noise, but there seems to be some procession near my house. The next question is, no one in my family has kidney disease. How did my child get it?
Yes, this is also a very common question that is asked. Like I said, there could be inherited conditions. Now, inherited conditions are not always genetics. Like, that all our cells are made up of something called genes, which, regulate the function of our body in all aspects. Okay, so there could be some conditions where the parents are carriers. Now, usually all of us have pairs of genes. So some conditions manifest when both the genes in the pair are abnormal. Some conditions manifest even if one of the pair is abnormal. So we call them as autosomal dominant, autosomal recessive conditions. So most often in children with kidney disease and many other conditions, they manifest when both the genes are abnormal. All right. So this can happen when both parents are carriers, because the child gets one set of genes from each parent. So if the parent has an abnormal gene, only one of the pair, and the other parent also has an abnormal gene, but one of the pair, that they may not be manifesting symptoms, but when the child unfortunately inherits both the abnormal conditions, they may manifest. So this group of conditions alone, so you may feel that nobody in my family had kidney disease, so how did my child get it? So this is one possibility. The other possibility is sometimes there could be inherited conditions, which meaning you have got it from birth, And it is related.
Thank you. And right now we would take up our next question, doctor. And that would be, well, we can go with the, two of them joined together. How we've already answered. One is, how can we identify kidney disease in infants? For all of you who have missed that question that came from Karam, is that you could go back to the slide, the slides of the, our presentation. That was actually Prasanna. Karamjeet Kaur, who's in Chandigarh right now, wants to know, what should a normal GFR for children be?
Okay, so that's a very good question, because what is important to understand is that when a baby is born, the GFR is very low. It's only about 40 or 50 ml per 1.73 meters square per minute. That's how it's the units are. So it's only about, just to put it in simple terms, it's just about half that of a normal adults. So that is why younger children, infants, are more prone to insults to the kidney. So a newborn who doesn't cry at birth, a newborn who gets infection, a newborn who has other cardiac or other issues is more likely to have a kidney insult than an older person is, because the GFR is low. And over the first 2 years of life, this rapidly increases to come to a normal in the sense, the adult normal value of 90 to 110 or 120 ml per minute by about 2 years of life. So after 2 years of life, a child's GFR is the same as that of an adult. So that would be the answer to the question.
Thank you so much. We also have to say a big shout out to Prasanna, who's completed 25 years on the single kidney transplant. So all of you remember that there is hope. We have another question from the audience, and that is from Ashok Kumar. What is hydronephrosis?
Okay, so hydronephrosis is the technical term. So what happens, unfortunately, I cannot show it to you very easily here, but if you can sort of picture in your mind that there is a kidney, it's a bean-shaped thing, and there is a tube that comes out of it that we call the ureter, right? So where the kidney joins to the ureter is called the pelvis of the ureter. So sometimes, either due to obstruction or due to any other reason, this may be wider than normal. That is called hydronephrosis. That's a very technical jargon for widened pelvis of the urinary tract or the ureter, where the kidney joins the ureter. So that may signify that there is a block, because, if you can imagine a pipe that's going, and or not a rigid metal pipe, but say a flexible pipe that's going, if you squeeze it at one end, the other end is going to obviously be bigger, right? So because there's more pressure and more volume collected in there. So that's what happens when there is a block. That's before the block widens, and that is what we call hydronephrosis. That could be a sign of some block. Either it could be on one side or both the sides. It could indicate a block, or sometimes it may just be a simple widening which may settle by itself.
All right, doctor. Now we have a question from the in-house people who are on our Zoom, asking how long does it take to cure the nephrotic syndrome?
Okay. So this is a very, very common question, and we absolutely understand the daily dilemmas that a parent of a child with nephrotic syndrome undergoes. What I try and tell parents, I don't want to be pessimistic. At the same time, I don't want to be highly optimistic and give them a false, utopian picture that everything will be fine and don't worry. So I tell them what is true, but with a little bit of positivity. So generally what we tell them is that the childhood onset nephrotic syndrome is something that comes again and again. And I prefer to tell this to the parents at the first episode itself, because if we don't tell this to the parents, they are very likely to say that, oh, that doctor didn't treat this disease properly, and so this has come back again, and let's go to another doctor, or let's try Ayurveda, or let's try some herbal medications or something else. So I tell them very early on that it is likely to come again, but we can control this disease. Now, what is the technical definition of cure is that once you give A medicine or B medicine, this condition should never come again. Unfortunately, that doesn't happen in nephrotic syndrome. That's That might sound quite disappointing, but the optimistic part of it is that children generally outgrow this. As they grow up, the number of relapses come down. As they grow up, the likelihood of having more and more relapses are less. Even their swelling and everything becomes less. But it is very difficult to say that at 12 years, there will be a magical, change, and then nothing is going to happen after that. So I prefer not to give such hopes to parents. I prefer to keep them in reality, but in positive optimism that as your child grows, it's definitely going to improve. It's definitely going to be better, but I cannot tell you at what age it will stop. For some children, it may never come back after 5 years. For some, it may keep coming very infrequently after, say, 10 years. So for some, it may keep coming frequently. For your child, exactly what it's going to be, unfortunately, there is no way to predict. So that would be the true realistic answer. I'm not sure how many would like that answer, but I feel it's better to be clear about it right from the beginning and not have false hopes.
Yes. So now, doctor, that question actually came from Nitish, and he's asking another question. What should the ideal BP be for a 6-year-old child? And actually, what is high BP for a child who is only 6 years old?
That's a very good question. So unlike in adults where, you have one cutoff for all ages, whether you're 20 or you're 40 or you're 60, whether you weigh 50 kgs or you weigh 150 kgs, the BP cutoffs are the same, right? But unfortunately, or whatever, for children, it's not so. For children, it depends on the age, on their height, and whether they are boys or girls. So we have elaborate charts. So actually, when you are, when you're a pediatrician, you have to be very used to looking at different charts, doing a lot of calculations because it's very, very age dependent. So the blood pressure values are based on their age, on whether it's a boy or a girl, and what their height is. So I cannot tell you off, hand a value that is normal for, because when your child grows up, it's going to be another value. So we need to, that is why you need to go to a doctor and get it checked. And generally we tell our parents that, look, this is the blood pressure value for your child, that is normal. So when you go, in case you can't come here for a follow-up and you're going to your local pediatrician, just ask them if this is above or below that. So the value of blood pressure is based on the child's age, height, and gender.
Thank you so much. We have a question from our FB Live from Ashok Kumar. He says, what is left open pyeloplasty in child, gross left hydronephrosis, and possibly Puj obstruction? It has been treated. How to follow up on this? Because the pyeloplasty has been done and the Anderson-Hines is also done.
So like I said, a hydronephrosis means that there is a widening of the pelvis, that is the part where the kidney joins the ureter, and that could be due to an obstruction. I think when it's usually very, very gross, it's very, very big, it's very likely to be an obstruction. And that, if that is severe, and we do some tests to find out what is the degree of obstruction, what is the level of obstruction, and whether that's causing harm to the kidney. And sometimes you may need to undergo a pyeloplasty, or Anderson-Hines pyeloplasty needs to be done. So that is what is called a PUJ, or a pelvic-ureteric junction obstruction, or a block at the point where the ureter meets the pelvis. All right. So a pyeloplasty is done to relieve that obstruction. So they do a surgery and a narrow pipe is made into a wider pipe so that urine can flow freely and there is no block. Now, after this, the child needs to be on regular follow-up. It depends on how early after the surgery is. Earlier after the surgery, you may need more frequent follow-up as time goes by. And if everything is going well, you may need less frequent follow-up. So it's best you go back to your doctor who has done the surgery, looking at how severe it was, what were the other problems, because sometimes it's rare, but they could have complications later also in the form of blood pressure being high. So they definitely need follow-up. If you're doing well for the first few years, they may ask you to come, like even say once in 6 months or once a year, but your doctor will be the best person to be the judge of that.
Thank you so much. We have a common question between Ashok Kumar and Aranya Nag, and that would be, what should be the average water intake for kids/teenagers And especially for someone who's 7 years old, this is Ashok Kumar asking the question.
So again, coming back to the pediatricians and their charts, it's all age specific. So it depends on the age and weight of your child. So let's take a rough, sort of estimate. A 1-year-old child who weighs roughly about 10 kgs would require about a liter of water. Okay, and as they grow up, maybe in the next 5 to 6 years, they would require about 1.2, 1.3 liters of water per day. During their teenage, they may require about 1.5 to 2 liters. Again, depends on their weight, height, and growth. So it's roughly about that much. So at least 2 to 2.5 liters beyond, say 15 years or when they are adults. So that would be the average intake. So for a 7-year-old, maybe about 1.2 to 1.5 liters is good enough, provided everything else is normal. This is in a normal child.
We move on to our next question, and that is, in kidney failure for children or anybody actually, are both kidneys affected, or is it sometimes just one?
So this again is a very, very common question asked. So like I said, the kidneys are amazing organs that keep, working silently till they can just work no more. And only when both kidneys stop working, you get what we call kidney failure. Now, people may be familiar that there are two types. One is a temporary failure, what we call AKI, which usually means that it is reversible, that there is a high chance that this will get sorted out in a few weeks' time with some medical support. And there is something called chronic kidney disease, which means that this is permanent damage to the kidney, that no matter what you do, it's not going to come back to normal and is going to be gradually progressing to worse and worse situations. So both conditions where the kidneys doesn't work happens only when both kidneys are affected. Because the kidney has so much of reserve that if one kidney is affected, the other kidney is extremely capable of doing the job of both kidneys. So you will never find out in the blood tests or in the child symptoms or whatever that this kidney is affected. So it's only when both kidneys are affected, or sometimes one kidney is badly affected, the other kidney is compensated to a point that it cannot compensate anymore. So that kidney is also now become abnormal. So only in that situation do you get any of your blood tests or your clinical signs and symptoms will be able to qualify as kidney failure. So it always is when both kidneys are affected. Or sometimes, just to give the entire picture, if the child has a single kidney, and if that kidney is affected, which is like 100% of the kidney that the child has, only then do you get kidney failure.
We have Ashok Kumar asking you another question, ma'am, and he was the one who asked you about PUJ. He said that PUJ was done in 2014 at 1 year old. We did follow up till 3 years. After that, the doctor said everything is fine, no need to follow up. What's your opinion on this? Any chance of getting CKD in the future? Can you advise on this particular situation?
See, generally, PUJ obstruction is not associated with CKD per se, the condition itself, but it depends also on how the other kidney is. If sometimes PUJ on one side can be associated with some developmental defect on the other side. So in such a situation, there may be a possibility. What we tell our patients is to do an annual follow-up. An annual follow-up to find out how the child is, most importantly, to check blood pressures, to check a creatinine and calculate the eGFR, to monitor growth, to see the child is doing well at school, completes immunization, everything else. So that is our thing. At least an annual follow-up is what I would recommend. You don't need to go to a urologist or a pediatric nephrologist. Even a good pediatrician may be able to manage this much.
Thank you. And now I'm going to club a couple of questions together, and that would be, can dialysis be done on children? Is it worth doing a transplant on a child? And do we get a kidney from the hospital for kidney transplant?
Again, very common questions that are asked. Yes, definitely dialysis can be done in children. It is again, like I said, there are two types of kidney failure, the acute or the temporary kidney failure, where we go all out, we definitely try and dialyze the child, because this is a potentially reversible condition. That if we treat the child, if we support the child to the maximum extent possible during this phase, it is going to reverse at some point or the other. So that is a condition where we have to invest all our time, energy, resources on, because we don't want to give up on this child. And dialysis is feasible. Unfortunately, in our country, dialysis in children, especially younger children, may not be done in many centers because of the lack of expertise, lack of facilities, lack of disposables. But I hope in the next few years it will be available, because we have a lot of training programs. We have doctors getting trained to do this, and hopefully it will be available even in every small town. As of now, definitely in big centers it is available, and it is definitely worth doing it. We also get a lot of try and get a lot of support, financial and social support for these children, because these are potentially reversible. This child can go back to be a normal child. The other kind of kidney failure is the permanent kidney failure, where dialysis is an option when the kidney fails to an extent where it's not able to do most of its functions, and that we call as kidney failure, or it was previously called end-stage kidney disease. Now the terminology is kidney failure. So here we offer dialysis to our patients. Again, the unfortunate situation is that many a times there is no government support for it. There are no centers offering this. So parents find it very difficult to continue this. So it's not that you should not do or you cannot do. It can be done. It should be done. We believe that every child should get a chance to get a kidney transplant. It doesn't happen in many scenarios because of the lack of financial, social, logistic support. But wherever possible, we do try and encourage our patients to go on to this. The second question is, is it worthwhile doing a kidney transplant? When the kidneys have unfortunately failed permanently and are no longer in the state to work by themselves, we offer therapies that are called renal replacement therapies. Now, what you should understand is, of all the organs in the body, the kidney is the only organ where you can easily replace it. You have so many options for replacement. You have dialysis, different types of dialysis, and you have transplant. So if there is one organ that can be supported to the best possible extent, at least in today's extent of science development, it's the kidney. So definitely this option should be given to parents of doing dialysis, using it as a bridge, and ultimately going for the best form of renal replacement therapy, that is renal transplantation. It is important because it gives you, it's of course nothing can compare to the God-given kidneys, to our healthy kidneys. Nothing in today's world can compare to that. But we are now in a dilemma. We are faced with a situation where we have a difficulty, a problem. There is a solution. So why not make use of the solution to lead as normal a life as possible? I'd like to, at this point, say that in our center, currently, we have done about 97 transplants. We are hoping to cross the 100 mark this year. So over the last 20 years, this is over the last 20 years, hopefully this year we will be doing our 100th transplant, and many of our children are doing very well. Some of them have got married, many of them are doing jobs, they have completed their education, they have gone on, a couple of them have had children. They have, of course, transitioned from us. We no longer take care of them because they have all become adults and they have gone on to nephrologists, but many of them have got a normal life, and looking at them, you would never know that they have gone through all this. So it is definitely worth trying. There is no doubt about it. We could do a lot more in terms of improving their quality of life and doing, many things for them. But as of now, this is the best treatment that we can offer, and every child should get a chance at it. As coming to the most controversial questions, can we get a kidney from the hospital? Unfortunately, no, it is not legal. It is not ethical to do that. We know that, over the years, you would have heard in the news, and there's a lot of controversy. There's a lot of bad mouthing about kidney transplant from media. But for the child, the best match is parents, and next is grandparents. So we encourage that. If your state, like some of the states have a very good deceased donor program, and if you happen to be in one of the states or access to a hospital that can offer you that would be a very good option too. but the parents would be the best match for kidney transplant. So this is your chance to give your child another lease of life. You have already given them birth, you have given them a good life. This is your chance to do it once again. So if it's possible, if of course taking care of your health and taking care of you first, the donor first, if you get this opportunity, please don't hesitate to do it.
First of all, congratulations to all of you at St. John's Hospital.
Thank you. Thank you so much.
7 pediatric transplants. That's fabulous. Thank you, Aryan, for suggesting that we all should clap for you. God bless you and your team. And may you reach the 100th, the 200th, the 5,000th, if there's such a word, so that more and more people are away from this disease. For all of you watching us, I want to let you know that we have a young boy on our chat, actually live with us, but he refuses to come on. The speciality about Aryan is that he's very young, but he's extremely aware of his disease. And I think that is something that all of you who are watching, and also parents, I know you're trying to protect your child from a lot, but once you make your child aware, he would be actually helping you in your own burden of dealing with this disease. And Aryan has a question actually here, that if you're on CKD 4, stage 4, that's chronic kidney disease stage 4, and on dialysis, what kind of diet regime should you be following?
Yeah, so thank you, Aryan. Very nice to meet you too, and very nice to know that you're so aware. Often, Anjali was saying, that we, parents definitely want to hide the fact from the child. And we also sometimes find it very difficult to explain things to the child because we don't know how they're going to take it. Some of them may be devastated. And when I went initially to other centers in Canada and in UK, I was very surprised to see how easily they counsel. They have dolls with, different kinds of kidneys, dolls with dialysis catheters. And before the child goes on to dialysis, they use all these simple play therapy and such kind of, methods to educate the child in the way that the child can understand. And definitely there's a lot of acceptance, there's a lot of understanding, there's better coping. So it's wonderful that you have taken charge and you are aware of your thing, and you are a role model for most of the children with kidney disease, and also a role model for all of us to make it a point to remember, because we are all stuck in the jargon of what to do next and how to get this done and how to get that done and how do we arrange finances and what do we tell the parents and which blood test to be done, that we often forget that this is the child who is undergoing all this and he needs to be a part of this. We should not hide it from him completely, tell them in a staged manner, tell them in a way that they can understand. Coming back to your question, so it will depend on a lot of things. Unfortunately, I can't give you a simple answer. What I would suggest is that the general rules would be to restrict fluid. That would again depend on how much weight you're gaining on while on dialysis. Restrict salt, because that is going to help control your blood pressure better. It would depend, the fluid restriction, actual fluid restriction would depend on how much urine you're passing and how much ultrafiltration you're getting and how much interdialytic weight gain you have. Depending on your blood tests, you may need to control your phosphates. Depending on your other comorbidities that are there, you may need to take more calcium or more protein or less protein. But the general dictum is that we try and tell children to take a balanced diet, to avoid junk, to reduce their phosphate intake, especially when they are on dialysis. Most children do require a restriction of phosphate. Sometimes when they are very malnourished, they may not, but most often they do. So take good protein. The good protein that will give you less phosphate but high protein that are good for children are eggs, pulses. The vegetable proteins are much better in this situation. Meat is not very good, but eggs and pulses are a great source of protein with less phosphate. So try this. Fluid intake, I would definitely say, needs to be restricted, but again, it depends on what your condition is. So these are the general principles. Potassium restriction also needs to be done in most, but we do advise them to take while on dialysis, or depending on their values, they can take fruits, or advise which fruits they can take, how to do leaching. It's a very, very customized prescription. So it's very difficult for me to tell you, like, a blanket answer to that.
Thank you so much. And since we are talking about this, I would encourage all of you who are watching or who've got a forward of this or happens to find this program on your feed on, Facebook, to please make sure that your children also watch it. Because it's very important, as Dr. Kamath said, for this to be a hand and glove thing. In fact, if your child is on dialysis and you need to be leaching your vegetables, it should become a household time where people work together, so that somebody's leaching the vegetables, somebody's squeezing it out, somebody's making the sandwich with it, so that it becomes like how we used to play na ghar ghar. It's very, very important that the family sticks together. A little bit of love and affection going to the parents who are actually the caregivers as well. Please let me tell you, it's horrible, I know, that you have a sick child or a child who's going through something. But the child is still a child and continues to be naughty, continues to do stupid things that bug you, just like my children get me bugged. So your reaction to them should be like you would be dealing with somebody who has no sickness. There is nothing wrong in reprimanding your child. There's nothing wrong in leaving your child home and going and getting your hair blow dried, or going for a round of golf, or going for a walk, or just going to buy sabji. The parents, if you have to continually give not only your time and your money to your child, you must have something for yourself, because really for us parents are closest to God. Yes, so I would like you parents who are here being caregivers, apna khyaal rakhiyega, apna dhyan rakhiyega, because without you the children are nobody, and this normalcy in their life will help them cope with their disease better. They will not grow up with yet again one more disease, and that's the disease of the mind, that everyone has to look after them because they have a disease. We have amazing people in this community who, in spite of the disease, have achieved all kinds of things. So please remember, first take care of yourself, and then you will be able to take care of your children better. And all the children who are watching, remember, you too need to be in charge, because you are who you are, and you've got all the dum in yourself to do this. I can't thank you enough for joining us, Dr. Kamath. It's been absolutely wonderful having you here. We have kidney warriors to thank, and today actually on technical support we have none other than our very own Vasu ma'am. Yes, the person who invented, organized, and actually got kidney warriors under one roof, fighting battles every day to make sure this happens. A big shout out to Supriya, who manages all our media and keeps posting it, and I don't know how she manages it. And for everybody who says, yes, we're going to go ahead and do this. It's been absolutely wonderful, a privilege. And as you know, whenever you have doubt, KWF is always there for you. Reach out to us. Our numbers are there on our website, on our Facebook page, on our Instagram page. We're always there to help you. Thank you ever so much. Sleep well, look after yourself. Please mask up. That horrid thing is still around, and sanitize. And Dr. Kamath, I have no words to thank you. You've made it so, so simple for all of us today.
Thank you so much. Thank you, Mrs. Raghavan and Anjali, for this wonderful opportunity. It was such a pleasure to be associated with you, and I hope I get the opportunity to be associated with you in many more ways. And I must thank you for your concluding remarks. Yes, parents need to take care of themselves. They need to, this is a very societal pressure, I feel, that is there on, especially on mothers, that you have to bear everything, and you cannot show your weakness or your inability to cope. But if you feel that you are not able to manage, get help, get support. We are all there to help you. It's a difficult journey, but we're all there with you. So I think that was a beautiful message that you gave to all the parents, and of course to the children, to take care of themselves, to take charge of their lives. That's also a great message for children with kidney disease. Thank you so much for this opportunity, and I hope to be associated with you in many more ways. Thank you.
Thank you so much. And for everybody watching and sharing this, please remember to look after yourself, because even if you're not an organ donor during your life, you could make 8 people live because of you. So look after your body, keep it well, because more people out there need you even when you're gone. So here's to all of us, making sure this community is not going to suffer. Look after yourselves, and lots of love from all of us at the Kidney Warrior Foundation. Good night. Thank you.